I'm sorry I got to skip out, so maybe just don't let Niru take up the entire first 30 minutes with his first answer, because I have to leave after that.
All right. Well, I appreciate that. We'll get started. It looks like we have a few participants joining, and as soon as we get everything, I think at the top of the hour, here we go. Whoop.
Could you see me?
Yeah, I did, but then it went away again.
I'm not sure why your video is not coming through.
My video is not coming through either.
Mine neither, Tara. It's a host issue.
It's so weird. Let me troubleshoot a bit. I'll be right back.
That's okay. I may, once my iPhone hits the top of the hour, I might just get started and introduce everybody and be mindful of everybody's time and commitments, and really just super excited that you guys are all part of this webinar series. So thank you all.
Yeah, our pleasure. Did you see where Dr. Burks gave a shout out to tennis today?
I missed it. I was in clinic all day long. What did she say?
She was just talking about opening up and mentioned tennis as really an ideal example of how to be physically active outside and still physically distanced.
Absolutely. No, I'm 100% in support of that. Yep.
That's good. Awesome. That's awesome.
We're going to be the best sport at the end of this.
Yeah.
I'm for real. This is the way to leverage the health benefits and really let people know this is a safe thing if you do it right.
Yeah.
For sure. Well, good afternoon and welcome to the USTA Midwest Collegiate Committee's third segment in our month of May Collegiate Webinar Series. My name is Tim Corwin, current chair of the USTA Midwest Collegiate Committee, and I also serve as the general manager at Western Racquet Club in Elm Grove, Wisconsin. I hope everyone joining the webinar is doing well, is healthy, and is excited to get back on the tennis court as soon as possible, as soon as safely possible. Throughout the webinar, if you have questions for the panelists, please use the chat window, and I will try to weave in your questions throughout the segment. Today, we are talking about player health and wellness and the college tennis player. Who better to join our panel than the Chief Medical Officer from the NCAA, Dr. Brian Hainline. Dr. Hainline oversees the NCAA Sports Science Institute, a national center of excellence whose mission is to promote and develop safety, excellence, and wellness in college student athletes and to foster lifelong physical and mental development. Joining Dr. Hainline is renowned sports medicine doctor and leader in tennis medicine, Dr. Niru Jayanthi. Dr. Jayanthi is the director of Emory University's Sports Medicine Research and Education. And last, but certainly not least, joining Brian and Niru on the panel this afternoon is our own USTA Midwest Collegiate Committee member, Dr. Liz Bondi. Liz was a standout student athlete at DePauw University in Greencastle, Indiana, where she was a 6-time All-American in tennis and the most outstanding basketball player on DePauw's 2007 NCAA basketball championship team. Dr. Bondi is now a leading podiatrist in the Metro Chicago area. Thank you all for joining us today. I'm going to start with Liz and then ask each panelist to reflect on the last 10 weeks of Safer at Home, describe what it's been like for them personally, and to the extent possible, if the COVID-19 virus has impacted their personal habits, any lifestyle changes or habits that have been a positive during such a difficult time.
Welcome everybody, first of all. But yeah, I think, like everyone else, dealing with not being able to go out, spending time with, friends and family, that certainly has an impact on kind of morale and that. But I think the nice thing that has come out of this, I do other races and things like that, and they've all gotten canceled and postponed, and much like tennis tournaments and, other activities, is that through these Zoom meetings and that I've actually been able to connect with prior teammates and, organize workouts with, individuals and friends of mine that aren't within the state. And so I get to spend a little bit more time talking with them than I probably have in the past. And I think that really has kind of helped kind of build a new network, and with the kind of emergence of some of these virtual races to kind of stay competitive and still have fun. I think it actually, has worked out really great in terms of connecting with people that I probably haven't been able to in the past.
Thank you, Liz. Niru, same question.
Well, it was interesting. I was reflecting on this a little bit after you sent that. And, I actually realized over the last couple of months, I actually have dinner with my family every day. I see my kids every day and put them to bed every night. I call my parents and my wife's parents every day. I call my parents more, but not my wife's parents. I only play tennis in my neighborhood or nearby neighborhoods, essentially. And I'm actually working from home 75% of the time. So those are definitely some things that I know will never happen again, in probably in my entire career. So I'm taking every moment of this and just savoring it. But at the same time, I'm also pretty anxious to get things moving, and I think this is going to be a great discussion. And we said it at the beginning of the call. I think tennis is in the best position to really move forward in a really refurbished, positive way after this virus, or during the virus even.
Thank you, Niru and Liz. Brian, I know you're leaving at the bottom of the hour. I'll let you bring up the rear on this question, and then I'll pose the next question to you. So has there been more time for red wine in the evenings with you and your wife?
Well, there has. So, previously when someone asked where I live, I always said, well, on an airplane, because there was so much travel. So we've been home for the last 2 months, and with our youngest daughter. So that's been a good thing. But I think the other thing, Tim, is that this is such a profound existential crisis that has affected everyone in the world. No one can hide from this, and it brings the potential opportunity for us to think about humanity and how we're all in this together. And crises sometimes become real opportunities. And so we're seeing that sort of happen. I think what Niru mentioned about tennis, so that's one example of an opportunity, tennis sort of coming out as being an ideal sport, but also, hopefully just the idea of understanding how we are so interconnected to one another. And this virus is a stark reminder of that.
Thank you. Yeah, that's very well said. Given the that many states are starting to open up again, do you anticipate tennis being able to resume competitions in the fall without a vaccine? Obviously, a vaccine would probably take 12 months to 18 months to get into circulation, hopefully sooner. But to what extent, Brian, do you see the landscape allowing safe competition, and what would need to happen for that to take place?
I think it's actually really possible with tennis. So the NCAA has 24 sports, and the most challenging obviously is football, where you have people who are not able to physically distance, and they're on top of one another. So we really have to understand how to develop protocols for that, which is going to involve testing and really a heightened sense of surveillance. But with tennis, you can set it up right, and so if the tournaments are organized in a certain way, the ingress egress is organized. It's everyone brings their own water. We there's a heightened sense of hygiene. But you can really imagine the competitions just taking off. So I think tennis is ideally positioned. Again, I echo what Niru was saying, and so so long as the gating criteria allow the states to continue to open up, tennis really can be, I think, at the lead of the sports.
Thank you, Brian. One of the follow-up questions. This was a question from your colleague Gary, who asked about the emotional stress for those that may not be ready to start competing again. How will student athletes who have a fear of contracting the virus kind of step back into competition? There's a certain population for whom if they're really just not ready. And maybe the answer is they should stay away until they're ready. But any guidance on the mental aspect of that?
Yeah, so two things, and actually we just released a survey today that we did with our student athletes. And it's interesting, the most vulnerable time for any athlete is with the sudden transition out of sport. And usually it's a forced transition, like an injury or illness, or you get cut from the team. And this was a sudden transition, but it was, an act of the universe, and it wasn't within anyone's control. And so it really affected a number of athletes. And one of the things that has come out is that many athletes are in this post-traumatic stress disorder type of manifestation. And for that, yes, ideally, it would be great to get back into exercise, but I think you're spot on, Tim. And, just getting back is not the answer. It's really coming to understand, the way that you manifested the PTSD-like symptoms, and then how you can, really manage them effectively, and that will eventually mean a return to sport, but forcing that upon someone could actually really have a negative outcome.
Yeah, thank you, Brian. Let's suppose this late August and September, as schools resume, and we look into our crystal ball, and hypothetically, let's assume that the campuses do reopen. With let's say there's no vaccine, will testing and contact tracing be far enough along by September to allow schools to safely conduct a fall season of tennis practice and competition? Brian, I think this is probably still in your court.
So there's two ways to answer that, Tim. And one is it should be. Even if you look at the national guidelines that came from the White House, which are really exceptionally well written, the foundation for really moving forward and opening up America again is to have really a syndromic surveillance system in place. So that means that it's year-round and it's really well done, and that you have boots on the ground people that can do contact tracing. And part of that means that you really have a great surveillance testing. And so, people talk about testing a lot. We don't necessarily understand what that means, and there's so many different tests coming out, and there's not sort of a national guidance on that. But a couple of things have happened that I think are going to be game changers. One is this concept of bulk batch testing. So if any of you have ever given blood before, when you give blood, a sample of your blood is pooled with 1,000 other donors, and they do one single test for HIV. And if that is negative, that means 1,000 people are negative for HIV. If it's positive, then you have to figure out, okay, are we going to do 250 times 4 or 100 times 10 and chase it down? So there was just a breakthrough in that sort of testing last week, where right now we can only do at maximum 4 or 5 samples, but if we can get up to 50 or 100, it's going to really drive down the cost of testing, and it's going to allow much more widespread surveillance. And the other breakthrough is if we can do salivary testing, because when you do the nasopharyngeal swab, it's actually dangerous, not to the person that's having the procedure, but for the person who's performing it, because it induces a gag reflex and a cough reflex. And so you have to have maximal personal protective equipment. So we can get the bulk batch testing, salivary testing, and then there's, if the antibody testing continues to develop, and there's now what we call new antigen testing, which would just allow point of care, meaning like you go to the doctor's office, you think you have the flu, they do a test, in 5 minutes. So I think there's going to be a revolution occurring in the next month or so, which is going to allow exactly what you're talking about. Because look at where we were, I've been in New York for 2 months. I mean, at the beginning of March, we couldn't do contact tracing because there were hundreds of thousands of people infected. In fact, we do the math right, according to the serology, there were 1.4 million New Yorkers infected. But now that the virus is under control and the R value is less than 1, so the infection value, if you will, now that's the time when we must do contact tracing, or we're going to be right back where we were in March.
Wow, very good. Thank you, Brian. Nero, you're a very active tennis player. You mentioned that you've been playing in your neighborhood. with the latest studies, as Brian alluded to, from the CDC, suggesting that the odds of contracting the virus from touching a surface is fairly minimal, does that bode well for non-contact sport like tennis resuming sooner rather than later? And like Alta, it's the biggest tennis league in the United States. What do you see for tennis players in general, but more so for the student athletes in Emory and around the country for tennis?
Yeah, no, absolutely. It's a great question. Brian knows I for a couple of months, I've actually been nagging him a bit about all these things. First, making sure that we were closing everything down, but the second saying, hey, can we let people know it's safe to play in certain restricted areas? And I think he came with the right message, said, first, we have to follow the public health message, which is everyone's got to just be at home, get through the worst part of it, then let's talk about it. So now when we revisit it, I think that, we get asked this question. I've done a couple other webinars on just return to tennis. We did one for CDTA a couple of days ago, and everyone asked that question. And, we've always advised, don't try to do research to see if there's a virus on the ball, because every surface can actually, have a virus on it. And the party line answer is it could last for a few days. The question is the level of inoculation. And so I just came from clinic, and, it's possible, I'm gonna get my antibody test through Emory, that I can get exposed to a virus in any of my patients just based on the prevalence in our patient population. But our inoculation rate is gonna be low. Like, I'm gonna be protected, I'm gonna be away from them. And it's gonna be very brief visits, even in a clinical visit, hopefully less than 10 minutes or 15 minutes. So with a tennis ball and other things in a low risk environment when you're hitting, and while, yes, it's possible a virus could exist if you had an asymptomatic player, I believe that that's just too low of an inoculation. And Brian, of course, is, he's just remarkable. He can, tell you his opinion as well. But I just think the inoculation is too low. I mean, you'd almost have to lick the ball in a way and spend a lot of intimate time. I mean, so we like it when people handle balls separately just to reduce that risk. But I think it can be played independently now. I actually do believe you can play competitively, particularly in singles. The issue is the social responsibility that comes along with it. The hitting isn't what worries me as much. In fact, tomorrow I'm going to play doubles with some responsible people for the first time, and I want to see how socially responsible they are. And I've been talking to Alta as well too, and that's our biggest concern: is what do you do before and after the match, and are you taking it seriously? So if we can get everyone to take it seriously, tennis can come back earlier, in my opinion. In all ways, competition, Alta, doubles, everyone's got to be bought in the same philosophy.
Thank you, Nero. Great answer. Brian, before you have to jump off at the bottom of the hour, a couple more questions before I turn it over to Liz. From an administrative standpoint at schools and universities around the country, how would schools prepare for another outbreak? Let's say it just comes back in gangbusters this fall. Hopefully that doesn't happen and we're moving in the right direction. What needs to be in place? And then a follow-up question: what resources are available for student athletes, coaches, and administrators? I guess that would be different for every school, but what kind of information do you have on that subject matter?
Well, so no one has a crystal ball, but I'll give you two lines of thought. One is if we just are irresponsible in the way we open up our country, and so we know that at most, I mean, if we look at the country as a whole, probably 1 to 2% of the population has been infected. So that means a large proportion have not. And this virus is so highly contagious when you have close person-to-person contact. So, so if we're just not responsible as a country, we're going to be right back where we were in August. So and if that's the case, all of our planning is for naught. So that would be a disaster. But let's assume that we are responsible and we can keep, the R value less than 1. The other line of thought, and a lot of schools are moving in this direction, is very interesting. It's picking up an enormous amount of steam. And that is that they're going to start maybe even a week or two earlier than normal. And they're going to have a shortened semester and in the semester before Thanksgiving. And then they'll send the students home and then they'll see them after the holiday break. Now, what's the idea behind that? Well, every school really has to have a system in place that is really well organized. It's going to be with their local health department, and it has to include surveillance, contact tracing. But you can really imagine, and you think of the school as somewhat of an enclosed society, and if you can control that society, well, you can really handle it pretty well, and keep, you know, this pandemic under control, and so it won't even become an endemic really as a manifestation. But when everyone all of a sudden leaves that controlled society, which is what Thanksgiving break is, and then they come back, all of a sudden that somewhat bubble community is broken down. So that's what a lot of schools are thinking. And then along with that thought is that this virus will remain endemic for some time. Tim, and you said a couple of times, you know, assuming we don't have a vaccine. And, you know, a vaccine, thinking about it happening within a year is exceptionally optimistic. I mean, you know, a very, very close relative of this coronavirus, which caused SARS, we don't have a vaccine for that. We don't have, you know, so it's difficult. And you know, some vaccines, like for dengue, it backfired, and actually the vaccine caused worse manifestations than the disease itself. So we have to be very careful about that. So in other words, we're coexisting with this virus for a while. And with that in mind, if it remains endemic, it would likely peak in November, December, around the time of the flu season. So that's the other reason schools are modeling in that sort of manner. So I think it's very interesting, and I suspect that more and more schools are going to be doing that.
Yeah, thank you very much, Brian. Liz, as a podiatrist, have you seen patients with COVID-19? Does COVID-19 impact the lower extremities and the feet? Come off of, can you hear me, Liz? You're on mute there. Oh, you're trying, okay.
You have to move your cursor to the mute screen, the bottom left.
Just so you know, Dr. Hainline has to step off for an emergency meeting because, well, I know that he actually has all the answers. So I contacted his secretary earlier today and made up this emergency meeting. So at least someone might actually listen to what I have to say. So it was so.
No, that's good. That's really funny. I wonder if Tara's on, if she might be able to assist Liz. And while Liz is trying to come off mute, let me ask Miru, what advice?
There we are.
Oh, good. All right, Liz, yes. It's on. You good to go? Talk about COVID-19 and the lower extremities.
Yeah, sure. So there's this, you know, the past couple months, it's been shown that there's something called COVID toes. Oh, yeah. And they're seeing in individuals that do have the coronavirus. It's typically in a younger, healthier individual. And what it is they're getting this discoloration in their toes, typically like a reddish, purplish lesions that can be painful, cause some burning. And so we're not exactly sure what the cause is, but it's been thought to due to an inflammation or small microclots within those little blood vessels. And in turn, that can restrict blood flow, which is causing that discoloration. And typically, you know, the good thing is it'll usually just resolve within 2 to 3 weeks. And I haven't seen anything that's shown any long-term impact on those toes. Like I said, just after 2 to 3 weeks, most of it is just symptom management and getting something from your doctor to help manage with that pain. And, you know, my recommendation for this is, yes, see a doctor just to get it checked out, whether it be a podiatrist, dermatologist, your primary care doctor. But this is the type of response that you will see in other viral infections too. It's not just exclusive to the coronavirus. So just if you start seeing those on your feet, it's not anything to be panic and be like, I definitely have the coronavirus. It also needs to be, you know, associated with some of your other symptoms. But it is definitely something to be aware of because sometimes that can be your only symptom as well. So it's just kind of something to be aware of if you do have it, that you should see a doctor who can just work everything up and take a thorough history.
Wow, thank you. That's really interesting, Liz. Brian, this is kind of the $64,000 question. Do you anticipate college sports having a fall season in 2020? Not just particular to tennis, because maybe tennis is the easiest sport to visualize having a season. And you did mention at the outset that the contact sport, a contact sport like football, really has enormous hurdles to kind of get through in order to visualize a football season in daily practice. I've seen some of your articles on that subject in the last couple weeks. And yet I know all the tennis programs around the country are really hoping that football can resume from a financial standpoint, as we're seeing some college tennis programs, decide whether they can afford to be, continue. So looking into your crystal ball, do you anticipate a fall football season, or is it too early to tell?
Well, so I have two answers, Tim. And my first answer is when I met with the most senior leadership of the NCAA and the Board of Governors, I told them that for 2020 and 21 that we should eliminate all of the sports except for tennis and just do all the funding for tennis because it's the only responsible sport.
That went over well.
Yeah. But yeah, so football is really the metaphor, right, of fall sports. And in some ways it's a religion in this country. And so people can look cynically at that, but there's another way to look at it, that if football can be played, it's a real physical manifestation of hope. And we're a society right now that's in desperate need of hope. And we can say, well, look, we shouldn't just do anything in 2020 or 21 and wait for this to pass, but we don't know when this will pass. And right now we're doing, it's not a binary question and answer. We look at the economic collapse of the world from this virus, and one public health manifestation of that is that right now 250 million people in this world are on the verge of dying of starvation because of the economic devastation of COVID-19. So these are realities, and so why would we want to get a sport back? But football is particularly challenging, and that's been already a couple of hours of my calls today. And so what it will really require is great surveillance, contact tracing, but testing. Because once you move beyond the physical separation of individuals, and you have people right on top of one another, and if one person is positive, then there can be spread. And it's not just the football players, right? So we know young, healthy individuals, they're no more likely to die of COVID-19 than from the flu. But there are a lot of higher risk individuals in sport, but especially those that are in the inner bubble of sport. And so that's really the concern. So the other paradigm that's going to have to take place in football is testing. And, so before you compete in the game, you're going to want to know that the individuals are negative. And the testing is only as good as the moment when you do it, but there's a lot of mathematical modeling that has gone on. And so you can, we're not going to be perfect, right? And there's always an assumed risk with any sort of sport. And there's going to be an assumed risk of playing sport with COVID-19 versus an assumed risk of not playing any sport. And that's what, as a society, we have to really be ethical and answer that with a lot of integrity. And so I think football can happen. But it's going to require a lot more control mechanisms in place than, for example, for tennis.
Thank you, Brian. That's great news. Niru, I remember
and Tim, and I'm going to have to go. So, and I really apologize. And actually, you're right. Niru did set all this up, but but it's Liz, it was great meeting you.
Likewise.
Virtually, Niru, nice seeing you again. Tim, and great to see you again. I mean, it's been too long, so have fond memories going way back. So thanks for the opportunity.
Sure.
Before you go, Brian, can I put in one big plug and request for all the juniors and seeing when we think we can open up some junior singles tournaments safely. I think we could do that pretty safely, hopefully, in maybe the next 6 weeks or so, based on trends right now. Local tournaments, not national.
Yeah, no, I know. I mean, I think that's really what we want to do, Niru, and I think we're really moving toward that. The national tournaments are trickier because of the travel.
Yeah.
And unless you're in a car, I mean, travel's tricky these days. So I think we're moving there, and we hear you loud and clear.
Thank you. Yeah. Be
All right.
safe, Brian.
Thanks
All
so
the
much.
best.
All right,
Okay.
All the
bye.
best.
Thanks.
Miru, I remember you very fondly from Chicago and coming down and watching you do a clinic, and you had some juniors out on the court with you, and they were recovering from overuse, back injuries, and some stress fractures. And I know, that's really an area of expertise and concern for you, this overuse. And as you envision all these tennis players that haven't been playing that much tennis getting back into a sport that can be very stressful on the skeletal system, what advice do you have for the student athletes heading into the summer without competition? What can they do to get better, and what can they do to prevent injury when they get back to competing on a regular basis?
Absolutely, Tim. And I'm going to actually answer this question because it's very near and dear to my heart. Even before the virus, I spent no less than 15 years trying to evaluate, research the optimum training patterns and training loads for high-level tennis players. And it's always been a concern of not just how much you do, but we're learning more and more about the rate at which you get to that point. And so that creates what we call our chronic workload and then our acute workload. And as we're talking, I'm gonna actually pull up I'm gonna actually share my screen to just show you one graph if that's okay. But the simple thing is that if you look at most data, your highest rates of injury are in the preseason. And so when you get preseason injuries, we don't feel like the athletes have developed enough of a resilience and really built a base. And so we need to make sure that these athletes it's going to take about 4 to 6 weeks. And if you start from nothing, if you haven't been hitting at all, then it could perhaps even take longer. And so I'm going to be really vigilant about trying to educate as many of those athletes as possible. So if it's okay, I'm going to just go ahead and share the screen, just show you this one graph, if that's okay. I've been doing a lot of this stuff recently here. And this is the graph that I'm talking about. And so this is, a study looking at college athletes, and you can see, and there's multiple studies that support this. The preseason is this big jump because these, athletes come in with variable training ahead of time, and they spike to doing what's asked of them, for example, in a college environment, and then they get a ton of overuse injuries. And this red line is COVID for me, and that's basically what we're doing. Everyone's coming in the preseason right now, so everyone's starting over. And you can't do it. That's why I ask now for Brian to tell 6 weeks in advance so I can get these junior players in these academies, the college players. You got to start planning your load. And I'm going to be busy. I was on court yesterday with 3 high-level, college and, getting into college athletes. And it's the low back, it's the shoulder, it's all throughout the body. But it's got to be about 20% increase at most each week at the most. It's going to take about 6 weeks, I think, to develop your load.
Fantastic. That's really helpful information. Liz, what do you see on the lower extremity injuries, like anticipating, like what advice do you have to protect the students for legs and feet? And I know feet are your specialty, but what can the student athletes do?
Yeah, so I'm going to echo a little bit here what Neeru said. He's absolutely right. And I think the most important thing moving into tennis season is building a strong foundation. In my case, looking at the lower extremity especially, and some of this translates to the shoulder and that too, is to really work on your core and your glutes. These muscles take on a lot of force that the body has to absorb. And if these muscle groups are weak, then basically it inhibits their ability to assist the lower extremity in a load response. And so as a result, it basically means that all that shock, that transmission of shock to those supporting structures of the foot and ankle, they're having to work harder to control the foot, having to control the ankle. And as a result, you're going to start getting tendonitis issues, ankle sprains, even some midfoot pain, because those muscles are just overworking and they're doing jobs that they didn't have to do and work as hard as they had before. And I think another important thing is working on your mobility, especially your hips. It's really important, shoulders, back, hips, and ankles, but the hip in particular, tennis in itself inherently asks a lot in terms of range of motion from your hip. And if you have an open stance forehand in particular, If you don't have a strong supporting structure around that and a lot of flexibility around that, you know, I think it's really tricky. And I think because of the coronavirus in particular, and, you know, college athletes, you know, you have to sit in classrooms all day, you're sitting and you're studying, you know, it really impacts your posture. And when you spend all that time sitting at a desk or on a couch, get tight hip flexors, you get weak hamstrings, weak shortened hamstrings, weakened glutes, you know, your shoulders internally rotate, your neck bends over. And all of this, when you go to stand up, and especially when you're going in tennis and you're having to work out, you're definitely, you know, going to end up having some injuries, especially lower back. Your knees are going to kind of cave in a little bit, causing your feet to roll in, and then you start getting a lot more tendonitis issues with that as well. So I think all those play a really important role. And like Neeru said, building up slowly, not just jumping right into it. And I think developing symmetry, making sure this is a great time to really be able to build the right and left side of your body. So I think those are really important points. And I'm not going to spend a lot of time talking about some of these other things, but I just wanted to kind of throw in as kind of like a side note. You know, hydration is super important. I can never talk about it enough with any of my athletes that I see. You know, it just, if you're not drinking enough, it's going to lead to fatigue, muscle cramps, spasms, your performance going to go down. So those are really key factors. And then obviously eating healthy, eating enough food. You know, I always tell patients, and I don't know, maybe Neeru thinks a little bit differently, I'm not sure, but I always tell patients, always eat before you eat, or before you work out, or before you're playing a match, before you're training, any of those things. Because what will happen is if you don't eat and you try and fast before and then go perform, your body is actually pulling all that fat from your muscles. So instead of pulling it from, you know, maybe your stomach area or other areas where you really want it to come from, go figure, it's going to come from your muscles that you really desperately need to work hard. And as a result, you're going to get decreased muscle pliability and increased fatigue. So all those things are really, really important apart from just the exercise standpoint and getting back in and to really focus on, especially as, you know, for those of us who are in the northern states where it's been cold, and as the temperatures increase, you know, it's really something that needs to be focused on throughout the day, not just while working out.
Yeah, that's awesome. Really interesting, Liz. This is more of a personal question. I was really intrigued watching The Last Dance and the Jordan documentary
Yeah.
that his trainer worked on his body much differently for baseball. And then when he said he's back, you know, the amount of time and effort it took to get his body basketball ready. As a basketball, tennis player, dual athlete, how did you prepare your body differently for basketball compared to tennis?
Sure. So, you know, a lot of it is a little bit, you know, the nice thing with tennis and basketball, they both, you know, they require those fast twitch muscles. It's not like I'm coming from a cross country season and then trying to jump into tennis or basketball. I think it benefited me because they use very similar muscle groups, similar muscle fibers. And so they kind of complement each other. So I personally didn't have to do too much different workouts in that because I would just combine them throughout the seasons. But I think if you have someone who is an athlete, like a cross country runner who also wants to go in and do tennis, someone who's got more of an endurance, a forward and back motion, I think it's really important because the muscle fibers that are required, that are recruited for more explosive exercises are going to be different. And so from that standpoint, it's different. The mobility is going to be a little bit different. You know, back when I was in college, mobility really wasn't something we worked on. So I think, you know, college athletes these days really have a one up on a lot of things because they can really have that opportunity to prevent injuries and work on those things that maybe some of us didn't have, you know, back when we were, you know, playing, you know, competitively in that. But yeah, so I think really just kind of working on those fast twitch, really thinking about what that activity requires from you. And, you know, a lot of the explosive stuff, doing the plyometrics and that are going to be really important. Working on side to side, you know, those are all really key things. I don't know, maybe Neeru has some additional things, but it's kind of where I find myself, you know, especially jumping rope, things like that, working on kind of the elastic properties of the muscle.
Fascinating. Thank you, Liz. Neeru, you kind of touched on this when you were talking about the 4 to 6 weeks of prep time and kind of building up, having that window. Any specific like Liz kind of talked about the core and the hips and the back. As you go up on the shoulder and the arm and the elbow, like, what are your kind of similar, mindset and philosophy in terms of, are there any big muscle groups up around the arms and the shoulders that really need a lot of attention that our viewers might be interested to kind of hear your perspective?
Well, sure. We could actually, we run literally 1.5 day, 2 day conferences on how to take care of the tennis body, and certainly we can go for a couple extra hours. And if you guys have time, no, I'm kidding, we won't bore you that much. But I was on I ran our Emory conference, and we had experts around the country on lower extremity injury prevention, Holly Silvers and Greg Meyer, on preventing those serious injuries on the lower extremity. And then we had a throwers 10, that's called the FIFA 11 plus. Then we have the throwers 10 for baseball players and baseball pitchers, which is focused on, the scapula, doing shoulder blade exercises. I'm really big on strengthening that involves deceleration, your follow through and your serve. So when you throw the ball back, for example, like a weighted ball, throwing it back and trying to make sure you transfer from right to left, and then have a slow, like use a weighted ball for a slow follow through, just engaging your ability to decelerate. But the reality is tennis requires all of it. It requires upper extremity injury prevention, lower extremity injury prevention, and trunk and core, which is why it's the toughest and most challenging sport out of all of them. So actually, as soon as that conference was done, we're going to probably work on creating what's called like a tennis 10 plus warm up and cool down program that gives you the best exercise for the entire body, because that's what tennis requires. So a lot of things that Liz said, we complement that with spine, right, spine, which is a very risky area, and then a lot of shoulder, which is scapula and rotator cuff strengthening in functional planes up here. So there's certainly a lot of work to maintain a high level tennis player, and even adult players, to be honest. If you're getting out there and you're playing Alta and USTA league matches.
Yeah, Nero, this question came in. I think you touched on it, but he may not have heard your answer when he joined the webinar. Do you think more of the injuries come from them going 0 to 100? For example, they slack off all summer and then they come in the fall to go hard and hurt and unprepared. So that was that's a question from one of our college coaches.
Yeah.
I think the question was not about like this spring. They haven't had much competition and they're going into the summer, but the gap is pretty similar. So let's say they're finishing the NCAAs. Let's say we weren't in a COVID-19 pandemic situation. It's a typical year. They go all summer without playing, and then a couple weeks, before they have to, get under 6 minutes on a mile. So the
Right.
question is that when they get hurt?
Yeah, and there's so much truth to that. And so I help with both the guys and girls Georgia Tech tennis teams, and each program has a different philosophy, right? This is a volleyball one, obviously the season, competitive season, the main one is in the fall, but just a different graph highlighting this. So let's say you're coming off from the summer, and we'll use this to translate into tennis, okay? Some tennis players are playing a lot of ITA tournaments in the summer. It depends when you start it. Like my advice is when you finish that heavy season, you finish NCAAs, you have to, once you get to 2 weeks or longer, you have to start all over. So you have no base anymore. And so I encourage that. Start all over, go sit in the pool and let your body recover for 2 weeks, 4 weeks, whatever it takes. Each person is individual. Sometimes we have to do it for the entire summer for certain people who have really serious overuse injuries. You return, you run this risk, right? You run this preseason risk. Like Todd is suggesting, you're right, trying to challenge it in a very short amount of time. So you have to have the eye on the ball and say, okay, when are we going to start hiking things up in college practice? So I need to give myself probably about 6 weeks to prepare my body to do that. And that's when you start ramping up your tennis playing. I think it is good to get some matches and some tournament play in so that your body is a little bit more resilient. So you don't show up with just the first time you're practicing regularly and hitting competitively. And then you have a fall season. And it's different. I really like to individualize it. I don't think the whole team can do the same thing, especially at the college level. If you're tolerant to these loads, then you go do the loads that everyone asks you to do through that fall season. The problem is this winter break. Remember, 2 weeks, you start all over. So can some players sustain competitive fall, like a late competitive summer, competitive fall, and then continue on with, you shouldn't stop over the break. You have to continue. So you got to figure out if you can sustain that or not. So you might, during your fall season, play it low a little bit, come back and have some sort of floor. So you don't go to zero, but you're not going full go the entire fall. So you going to go, at a lower intensity with volume. So then when you get back into your busy spring, your main season, that's when you peak. And so you got to figure out who that's gonna be. And some people are not doing much at all in the fall. I might suggest that they're not tolerant to these competitive loads in the fall. Their job is to get healthy for this. And you got to give that up a little bit if you want them in the spring. So Todd, I totally agree. But it really takes an individual effort. So we really spend a lot of time individualizing programs rather than saying everyone's got to do the same thing.
Fantastic. That's really helpful. Good question, Todd. Uh, we're kind of getting toward the end of my list of questions, and just maybe Liz and then Niru, any closing words of advice for college student athletes during this time that maybe you haven't already touched on? And then while Liz is answering, if there are any questions from the participants, the 20 or so that are still on, now would be a good time. It's 4:45, so we're kind of nearing the end of our panel discussion. And I think we answered Jeff Newman's question earlier about the ability of the COVID virus to transmit through materials such as a tennis ball. Jeff, if you're on, I'm not sure. Yeah, you asked that question quite a while ago, so I hope you were listening when Nero was talking about that. I'm sure Nero can touch again on that as he wraps up. Any final thoughts, Liz, in terms of the student athletes and advice over the summer and heading into the fall?
Yeah, sure. So I just, I think the most important thing is to realize while this is all a tough situation that, we're all in, especially, athletes with all the uncertainty, is that this also provides a great opportunity. Usually in the summer, it's really difficult sometimes to maintain the level that you want to, or you're so busy that between tennis and, regular life, it's just hard to squeeze everything else in. And so this is an opportunity where you can really take the time to build your base, do things properly, to keep yourself injury free, and really kind of do the things that usually you kind of put to the side that you don't really want to do, like stretching, mobility, weightlifting. It's kind of like, oh, well, I'll play tennis and now I've got other things and forget all about it. So I think, using this and switching it around to a positive and being like, wow, now I have this time, I can really kind of focus in on the things that I really needed to that I maybe couldn't in the past. And then realizing if you do start noticing aches and pains is to see somebody. Don't wait and be like, oh, they're going to tell me I can't play or I can't run, I can't do anything, and then wait till you get closer to the season to deal with it, because then it's going to be a bigger problem. There are plenty of other things out there. If you are starting to get injured, and you want to still be active, there's deep water running and pools are going to start opening up soon, and you can get involved with that, and you're not getting any weight bearing on that. Lower extremity, and it takes a lot of the stress off. So if you're trying to get back into running and cardiovascular shape for tennis, and you're not ready to start running, that as frequently, you can intermix it. There's Alter G treadmills that, take some of the weight off your lower extremity too. So there are options out there that don't involve you not working out, not running, just because you might be getting some symptoms of an injury. So don't be afraid to go in and see somebody, just because you don't want to be told that you have to stop doing what you've been doing.
Great. Thank you, Liz. Great answers. Great commentary. Niru, thank you so much for being on. What are your closing words of advice for the gang?
Look, there's no better time to be a tennis player, I believe, than right now. We have to reiterate the things that we've been trying to push for, and I'm going to share the screen for one last slide, is that tennis is already the healthiest sport to play for everyone. We have to leverage this so much better. You're going to live almost 10 years longer and reduce your risk of dying by about 50% before all this stuff. You need to exercise to improve your immunity, and tennis provides many of those aspects, right? So we have to really, try to push for this. Now, this is the time to leverage tennis. And I created this is what I was telling Brian. I sent this to Brian about 2 months ago, and he thought it's too early to tell people it's okay to play tennis, okay? And some of you might have seen it. It got distributed really quickly. And this is my phased approach to return to tennis, this graph, hope you can see it. And I think we're getting through this. Like we're done playing, you know, you can play singles. I would get my college players playing, find their courts, and you know, find a low risk asymptomatic partner, start hitting at least 1 hour a day, 2 hours a day. And you can do one-on-one privates. I believe so. Follow your precautions, be safe. Tomorrow is my first day playing doubles with low risk asymptomatic partners. I want to see how that goes, partly to see, are we following those rules? And then we're getting to the point where you should be able to do in certain areas, you know, low risk small groups, three players, you know, junior players, college players. Your community, Georgia, is moving a little bit farther ahead. Chicago, I just did a talk with, you know, the other, you know, 2 days ago, and I think they're maybe about 2 to 4 weeks behind, but that should be happening this summer if we're responsible. And I think it's time to start moving forward responsibly, okay? And we all have to be role models in that when you do it. And if we do it responsibly, where we're following our precautions and keeping distance and running maybe, you know, some programs, a little bit of your programmatic stuff, we have successes every 2 weeks to 4 weeks. You start adding on, you start going down this scale. And I think we can get tennis back. And I look forward to that. I don't know where college tennis is going to go in the fall. I think I would push for it. The safest bet is to do driving distance competitive play and stop and save some money, because money's gonna be tight right now for this year, and see how it goes, and really save your stuff for the spring. But start training. I believe you guys start training. Start your training now. And it doesn't have to be heavy, but start developing your floor. And you know, I'm out there, I'm hitting, and be safe. Be safe. Teach everyone to do it. Not, you know, tennis is the best sport to be involved with right now.
That's fantastic. Thank you, Niru. Thank you, Liz. Thank you to all the viewers that listened in. Some good questions.
Oh, I'm sorry, Tim, and for Jeff's question, in case he didn't get answered, the last thing is, and Jeff, hello, Jeff. You know, it's about the level of inoculation, okay? People scare me much more than surfaces and balls and rackets and benches and gates. But if someone comes near me, I'm gonna say, I say it all the time, I go, can I just have a little space? That's the type of responsibility we need to do. We need to wear masks when we're around like a clubhouse or indoors, not when you're hitting. So it's people, the risk of inoculation of a ball is so much lower than a person coming near you who might be an asymptomatic or pre-symptomatic viral spreader. So if we can keep people apart in and outside of tennis areas and do great, you know, do the hitting, we're gonna be probably a pretty good place.
Awesome. Thank you, Niru. Listen, before we jump off, Tara, thanks for all you're doing on the social media and marketing front for the Midwest section. Incredible ads and graphics and getting the word out for today's webinar, and certainly the one next week as well, and those that have come in the prior Fridays. Special thanks to Chad, who's on the screen, making sure I don't screw up. And our series continues next Friday. We will feature a distinguished panel, including 3 leading experts from the NCAA, including Lauren McManigal from the NCAA Eligibility Center, Sarah Hebbard from NCAA Membership and Academic Affairs, and John Bugner from the NCAA Championships. I wish everybody a healthy, safe Memorial weekend. And again, Liz, Niru, tremendous job today. And we were really fortunate to hear Brian speak as well. He was just, Dr. Hainline was tremendous. So kudos to you guys. Signing off, everybody. Take care.
Thanks, everyone. Be
Take
safe.
care.
Thanks so much, everyone. Thanks, Liz. Thanks, Tim.
Thanks, Niru.
Thank you, guys.
Bye-bye. Take care all.
Bye-bye.